Hello, my name is Isabella Riera and I'm going to do an interview to Andreina Schultz, the registered dietitian. Hi, how are you?
Hi, Isa, how are you?
Fine.
So what do you have for me today?
Okay, we're gonna ask some questions about a patient that you may have with obesity.
Okay.
What caused this disease?
Well, normally obesity can be caused by several things. So one of the things, it's the most common one, it's mostly for excessive calorie intake. So basically is when a patient eats too much or eats more than the patient is supposed to be eating calorie-wise. And then you have another case, which is hereditary. Obesity has been found to be a genetic disease. So normally, if your parents are obese, most probable is that you're going to be obese also, unless you make changes, and of course you can go another way. And then another one can be just because of any thyroid diseases or any hormonal complications that you may have that lean towards getting you to be obese, basically because of hormonal changes.
And in a patient specifically, how serious was that disease and how did it affect its patient's current life?
Well, actually, currently we do have a patient. I am a clinical dietitian, so we do have a patient inside the hospital that obesity caused him to have something called cellulitis, which is another disease. That cellulitis got infected and got his entire body to be infected. So because of the obesity and all of its consequences, you would say, he got the cellulitis, it got more infected, he got an infection in his entire body, in his blood, and now he is in critical care and he's fighting for his life, basically.
And what's the prognosis?
It's actually very poor as of now. Mm-hmm.
And why did the patient come see you?
Well, the patient came initially, as I said before, because the patient had cellulitis, which is another disease, came into the hospital with that. And throughout the course of the hospitalization, the patient has gotten worse. And basically, it's all because the obesity part. Obesity tends to be a disease that puts your entire body in a very severe inflammation state. So normally, bodies that tend to be in an inflammation state, they tend to be more stressed out and they tend to cure a lot less and a lot slower if they do get cured from any other diseases caused by the obesity.
So the patient already knew he was obese, or she?
Yes, of course. Mm-hmm.
Okay, and what other symptoms does the patient have?
The patient has, well, as obesity, normally it causes a lot of other diseases. So this patient in particular, he also has hypertension. He has cardiovascular disease. He has thyroid diseases. He has a lot of complications from the obesity part.
And how was the patient tested and what did those tests reveal?
Well, we do every day what we call lab work, so it's blood test. So you could see perfectly, actually now the patient is going into renal failure as well, so his kidneys are failing, and you can see all of that in the lab work. So you could see high cholesterol, you can see renal failure, you can see high triglycerides, you can see when you have an infection, there are certain labs that tend to be higher, so you have all those markers that are positive for infections. So all of those tend to give us like a view on where the patient is now in the course of the hospitalization.
And what were the treatment options that the patient had?
Well, first of all, if the patient had received treatment before he came into the hospital, which would be what everybody knows, making sure that you're eating correctly, that you're exercising, and if the patient had lost weight, probably none of this would have happened. In the case that it did happen, still, the treatment options are much larger in the sense that because the patient is obese, treatment options are very, very limited. Because medicine has not really been made for people that are morbidly obese, like this patient that I have. So normally all of the dosages for medications and when a patient goes into respiratory failure because of all the complications that they have, none of these parameters are made for morbidly obese patients. So the treatment options for this specific patient is very limited because of the obesity. So you still receive the treatment for the consequences of the obesity or the secondary effects, like you receive antibiotics for the infection, you receive medication that lowers your blood pressure, etc., etc. So there's actually no treatment as of now for the actual obesity, but for all of the side effects because of the obesity.
So the treatment does not have any the patient has not had any treatment established, or
I mean, he is under treatment. Just the nutritional part, which would have been before. I mean, we are intervening as a dietitian. You do intervene because the patient still has to be fed. So the patient is actually fed through a tube that goes directly into his stomach, from the nose to his stomach, and he is fed by a formula that we calculate, and that's how we feed him now. But if he had treatment before, like if he had the option for any gastric surgeries or anything like that, that would help him lose weight, because this patient is morbidly obese. Morbidly obese means that he's very, very obese. He's like on a very high scale of obesity. If he had received these treatments, probably none of this would have happened. But since it did, now the treatment nutritionally is just to feed him through the tubes and make sure that he doesn't get malnourished at this point.
And how effective is it?
Well, it's actually very effective, because if you do not feed the patient can get malnourished. Even if he's obese, he can lose a lot of muscle mass, which can get him to get more complications, because his immune system is down. If he doesn't get fed correctly, the body is trying to fight without any energy going in him. So the body eats its own muscles. So if you don't feed the patient can get malnourished, even if he's morbidly obese, and that can complicate even more his stay in the hospital. But for the other things, he is receiving treatment that's medically. He's receiving treatment for the infections and for all of the other things that are wrong with him right now.
So all of those things would happen if he didn't receive any kind of treatment.
Since he didn't receive any treatment, probably this is why all of this happened to him. Because he didn't do anything about his obesity beforehand. So now it's a little bit late,
But if he didn't do anything at all, like if he would never come with you, what would happen to him now?
So if he would have never come to the hospital, I don't think he would have survived. But especially if they had not contacted us, the dietitian services in the hospital, to look at this patient, assess this patient, and treat this patient, then the patient would definitely get malnourished, because we're the only ones that are able to dictate how a patient gets fed in the hospital. So yeah, if they didn't come to us for these recommendations, the patient would get malnourished and definitely get more complicated than what he is right now.
Okay, and at last, what new technologies now exist to prevent, diagnose, or treat this type of disease?
So basically, there's a lot of technology for obesity. It's one of the mainstreams right now for everything, how to lose weight, how to make sure that you look pretty, and all of this, right? But basically, it goes down to the roots. If you eat well and you exercise, that's the best technology there is for trying to cure obesity. But then again, I mean, you have a lot of gastric surgeries that you can do if you're morbidly obese, like the patient that we have. Definitely, that would have helped him out. Nowadays, you have a lot of medications that can help you out, and it also depends on how you got the obesity that would help you lose the weight or prevent the disease from happening in the first place.
Okay, thank